Guys, what's going down? Dr. J here with another online metabolic training specific mobility for headaches as well as TMJ. So there's not a ton of movement, but you guys have seen me already. If you guys have reviewed some of my past trainings, a lot of it does go into thoracic mobility, cervical mobility, and a lot of those things can really help with your headaches as well. But I do want to break it down a little bit more and see how the TMJ is in response to the rest of the body. So TMJ, there's a lot of different types of TMJ, right? So we can't just cluster everything into one. But realistically, for a lot of the clients that I've treated with TMJ disorder, and I've even treated myself, is that a lot of times you don't even need to touch the jaw. So many people are fixated on massaging the jaw, or like getting their hand in and kind of like massaging muscles inside the jaw. That's what a lot of people do. But realistically, I've treated it so many times in regards to just strengthening postural muscles, cervical, working on cervical mobility and thoracic mobility. You work on those things, a lot of times TMJ gets better on itself. So let's kind of dive into TMJ. So the first thing you want to look at is you just want to assess your jaw movement, okay? So one of the things that's easy is just open your jaw as much as you can and close, right? And a lot of times you'll feel restrictions, or you'll feel like one side click, one side not click. You can even test out medial as well as lateral deviation. So lateral deviation to the right and then to the left. And you can kind of feel like which one's more restricted. Does my right side feel tighter when I go to the left, or does my right side feel tighter going to the right? And that kind of gives you a little bit of data and information on what to do with your TMJ, okay? The other thing that you want to see in regards to TMJ is how good of cervical and thoracic mobility you have. So when you look down, does it affect your TMJ? When you look up, when you look right, and then when you look to the left, and then when you side bend, and when you side bend, does that affect the TMJ at all? And then the same thing goes as those similar motions, but with the thoracic spine, is you would usually sit down in a chair as so, and then you want to test out how your thoracic spine feels. Does that feel tight? Does that start to affect the neck at all? Thoracic flexion, okay? You go to this type of position and you can test out how much rotation you have to the right, how much rotation you have to the left, and then lastly, you can also test out your side bend. So hands on your head, and then you side bend, and then you side bend, okay? Generally, you don't have to be an expert at looking at yourself. You don't have to film yourself. You just want to feel like, where do these restrictions feel? How tight does it feel? Does it affect my TMJ? Does it affect my headaches? All right? Because headaches and TMJ, they will often come together. If you have any TMJ pain, oftentimes like cervicogenic headaches, they'll come in. It's called the ram's horn deformity, where you'll start to rams have those big, long tusks right along the ear side, and then you'll start to feel pain either on the right side or the left side. TMJ can often refer pain to the neck as well as the shoulder. Right? So these are some things that you want to look at. It's oh, if my shoulder hurts after I eat, right, then that's something that you want to look at, right? So enough in regards to education. I can go forever in regards to talking with you guys. Let's actually dive into some exercises. So first one I like to do is, most people, because we are desk-bound professionals, we're sitting, a lot of us are stressed, as a lot of us don't realize that we're not breathing and that we're clenching our jaw. So one of the easiest things is just close your eyes, and then you just close your eyes and you want to feel where your tension is, okay? So some people feel like their right shoulder's hiked up. Go ahead and relax that, okay? If you feel that your jaw is completely closed and you're not breathing, then go ahead and just actually let gravity do its thing and relax your jaw, okay? Even that in itself is an exercise. So open your jaw. I always call it just allow a freeway space. Eventually you'll feel your jaw just kind of hang down. And then after you hang down, what I'd like for people to do is called controlled opening. Now, if you're having any pain with opening your jaw very wide, then what you can do is you're going to put, maybe I'll get a little bit closer for this one. You're going to put your tongue on the roof of your mouth, and then you're going to open up your jaw as wide as you can, but keep the tongue on the roof of your mouth. So it looks like this. And then you're going to open and close 10 times. And you'll actually feel muscles working, and that's called controlled opening. You can't really open your mouth that wide if your tongue's on the roof of your mouth, right? So second exercise here is we want to go tongue on the roof of your mouth. You want to open your jaw, and then you want to protrude it, because that is the natural opening movement. A lot of people with TMJ have trouble coordinating the movements of opening the jaw plus protruding the jaw, okay? So it's a mixture of opening plus protrusion that actually clears up some of the TMJ pain. So it'll look like this from a side view. And you want to stand with good posture, try not to be forward head. So you're gonna do this. All right, did you see how that works? So it's open, then push out, push your chin forward. So oftentimes when you start to do that, you'll actually feel like a decent stretch. When you protrude your jaw, you should feel a stretch by your ears because what you're doing is you're actually opening up the TMJ joints, okay? A lot of times when people protrude their jaw, they will protrude their head at the same time. That is not what we want to do. Oftentimes when we're forward headed, it actually closes down on the TMJ and actually starts to make it feel worse. So make sure, like for camera point of view, I sometimes get into that. So make sure your head, make sure your ears are in line with your shoulders. Make sure your chest is kind of in front of your face. And then you'll do the opening 10 times. And then you want to do opening plus protrusion. And when I protrude, I can really feel a stretch in my jaw. All right. So let's say you're looking at the mirror, and I'm going to get very close and personal with you guys. So let's say that I'm opening. All right. And then I'll actually look in the mirror and I can actually assess this part. You can actually see your jaw. Oftentimes people will either have a C curve in which their jaw will like open up to the right and then come back to the middle, or you'll see that it kind of does like an S-shaped curve. And then those are different types of TMJ disorders. What you're looking for is any sort of deviation to one side. And if you're deviating to that side, that one means that one side is not opening correctly or that side is restricted. So for example, if I open up my jaw and I feel that my jaw deviates to the right and comes back in and I see that C curve, then what I want to do is I want to push my jaw the opposite direction. All right, so if it opens up to the right, I might push it to the left. All right, so I'll show you how that looks. You're going to put like one thumb, comfortably along the ridge of your jaw, and then you're going to open. So as you're opening, you're actually correcting the deficit by pushing that direction, all right? So that way, when you open, you might still see the curve, but maybe the curve will not come with pain. So I'll show you again. Thumb here, if my jaw deviates to the right, I'm gonna push to the left, okay? So as I open, try to open straight open, and then have your hand just slightly push it to the left. All right, so I did about 8 of those. You can usually try about 10 to 15, do that every couple hours. So we already went through specific exercises specifically for the jaw. Like I said before, it's about a lot of the things that I've done before, which is cervical stretching, making sure your head is right on top of the pedestal, making sure your upper back is moving. So many times, it's like if you clear up the upper back, it dramatically helps with the TMJ. So I'll go through it one more time, just many different options. But one of them, you can go here. We'll try 8 to 10. I've been sitting for a long time, so let's do these stretches together. Just opening up your chest, pointing your chest and your elbows towards the ceiling, okay? You can keep the tongue on the roof of your mouth and keep your jaw slightly relaxed. Don't clench your jaw as you're doing the thoracic extensions. And you can really make that a habit by, instead of clenching your jaw while doing these thoracic extensions, make sure you just exhale as you lift up your elbows. So you'll hear it. Okay, that shows me that I'm not clenching my jaw, but I'm actually breathing out. All right, then what I like to do is I like to rotate. So I've gone through a couple rotation exercises before. Sometimes I like to cross my legs, get my elbow over the side of my thigh, other hand grab onto the chair rest, and then wring out the spine, go into thoracic rotation. Exhale, exhale. Oftentimes it just needs about 3 to 5 of these. And then you repeat. So you cross leg over, get your elbow all the way across your thigh as far as you can, grab onto the backrest and rotate. So little tidbit is that if you don't get your elbow far enough, then you're gonna feel that more in the mid to lower back. But if you get your elbow further across, that's gonna make the scapula have to rotate and the whole upper trunk to rotate with it. So not just this, where my elbow is not on top of my thigh, I'm definitely gonna feel that more in like the mid lower back. If I go here and I bring my elbow all the way across and then I rotate and initiate from the shoulder blade, I'll definitely feel that more in the upper back area, right? And that's what you need. When you start to clear up this upper back area, then you start to notice that the neck pain, the headaches, and even the TMJ starts to lessen. All right, cool. So one of my other ones that I've done before, bent forward thoracic rotation. Go hand here, left hand, grab onto the inside of your left ankle, and then you're gonna rotate up. Okay, I've done this before, and I'll do it again because it's a great exercise, specifically for, again, the headaches and everything too. If, let's say, your head hurts, let's say you start to develop a headache doing this, then just keep your head fixated to the floor and just let your hand rotate. So instead of looking up towards the ceiling, I'm just gonna keep my head down and then just rotate my torso while my head stays fixated looking at the floor. All right, same thing. Grab onto the right ankle now, rotate. And this is all just preference though, because I can look up, you might feel a little bit better. All right, cool. So let's kind of go into some lying down exercises and even some hands on the ground exercises. So great one to do is to just go into more of a downward dog. I call it a push up to a pike. So what you'll do is you'll keep your chin tucked in, get into a push up position, push through your palms, and go as high as you can until you start to feel a stretch in your shoulder blades and your back. Okay, try to round your back first, then push up. Round again, push through your palms, and up. Push up, and work. And one more time, round, and up. All right, so let's go through another rotation stretch that you can do on the floor. I like to put my elbow on the ground. I call it a thoracic rotation with pec stretch. So you're gonna get your elbow right in the middle of your knees, okay? One hand on top of your head, and then you're going to open your elbow towards the ceiling, okay? And I'm gonna look up. I'm gonna look up. Wherever my elbow goes, my eyes are gonna follow. Okay, another version of this is if my hand on top of my head is like it feels too heavy, then I can just put my hand on my chest and rotate. Okay, hand stays fixated on the chest and then just rotate the elbow up. So I'm going to repeat, elbow down on the ground, hand, rotate. Okay, modified version is hand on the chest and then rotate up. All right, so one of my all-time favorite exercises, and it just depends on the person, so this can really clear up a lot of things in the upper back tightness. It can really clear up headaches and TMJ all at the same time. I call it the thoracic cat-cow. So many of you guys are familiar with hands down on the ground, and then you go and you kind of rotate through your abs, and it's more of a lumbar stretch, okay? How do you make this more about the upper back and the neck is you're going to rock back onto your butt, elbows down on the ground, and when you rock back, what it's going to do is going to lock up the lumbar spine, so all the movement's going to come from the upper back. Okay, I can put my hand on my head, and now I'm going to initiate all the motion from my upper back. Okay, you don't need your hand on your head. You can just have your hands down. Keep your head nice and low. Same thing. Okay, round through your upper back. And repeat about 8 to 10 times. 2 more. All right, cool. So today was definitely a nice little mixture of TMJ plus headaches. There's many different types of headaches, okay? Cervicogenic, cluster type, migraines, okay, tension type. All of these are, it's really hard to depict exactly what's going on, but that's where a physical therapist can come in and really decipher which exact kind of headaches you are having, or in conjunction with a combination of TMJ. And there's many types of TMJ disorders as well. So let's try, I'm not trying to pigeonhole or trying to do exercises that are jack of all trades, but I am giving you some pretty honest exercises that can actually help clear up both. So if you guys have any questions at all, feel free to message me. Feel free to throw in some comments into the live section below, and I'll be happy to help you.